Good evening, everyone. It is Thursday, July 2nd, and I don't know if you can hear the background noise. I was hoping that my son would go to sleep, and he is instead sort of pitching quite a fit downstairs, but my husband's with him, and hopefully he'll go to sleep soon. He's fighting it tonight. All right, I'm going to do a quick review of the statistics. The overview is that we have completed 49,615 tests. We have 1,229 cumulative positive COVID-19 cases. That includes 600 active, 620 recovered, and 9 deaths. And that is actually the information has been posted. And I do want to inform you that there have been an additional 2 fatalities today, which brings our total number of fatalities due to COVID-19 in Sonoma County to 11. So we have experienced 11 losses of human life to date. I do know that the cases, that the people that we lost today were inpatients in hospitals. Previously, a number of the fatalities that we have experienced this week have been related to a skilled nursing facility. Going on with the statistics, looking at the ethnic breakdown, 82% of the cases are in the Latinx community, 25% white, 3% Asian or Pacific Islander, and 2% other, and that other has an asterisk that does include Black as well as Indigenous community members. With respect to where these cases are occurring, we have 3% occurring in West County, 9% in East County, 7% in North County, 21% in South County, 58% in Central County, and 3% remain under investigation. Looking at the age breakdown, remember that a lot of folks were asking for a long time for a more detailed age breakdown. And if you go on socoemergency.org and you click on the coronavirus sort of landing page, and then you click on the dashboard, it does have a more detailed age breakdown. So we actually have children under the age of 5 comprise 4% of the positive cases. Ages 5 to 17 comprise 13%. Ages 18 through 24 comprise 13%. Ages 25 through 44 comprise 43% of the positives. So there's a substantial chunk of the positives in that 25 through 44 years old age range. Ages 45 through 54 are 15%. Ages 55 through 64 are 10%. Ages 65 through 74 are 6%, and then 75 and up are 5%. Of the total cumulative cases, 53% are male and 47% are female. You can also go on socoemergency.org to find the specific breakdown with respect to sectors. I'll just give you a quick rundown. The top 3 sectors that we are seeing the COVID-19 positives are in services and sales, number 1, ag and farm work, number 2, and healthcare, number 3. I want to talk a little bit about the state criteria. And, for quite a while ago, we did submit an attestation to the state that included specific metrics that we would be monitoring each and every day, each and every week. And those metrics can kind of advise the state as to whether we should, go forward along the reopening pathway, whether we need to stay sort of the way that we are, or whether we need to ratchet back. And I do want to let you know that new data was posted today regarding the case rate. So the number of cases per 100,000 residents over the past 14 days, which is one of those metrics. And ideally, that would have actually been under 25. That was kind of the original goalpost. We are now at 86.2 cases per 100,000 residents over the past 14 days. We are also out of compliance with respect to the ICU beds available, that metric. Ideally, we would have more than 20% of our ICU beds available. And right now, only 14.9% of our ICU beds are available. Another criteria that we are out of compliance with is with respect to the skilled nursing facility, because unfortunately we have had a substantial outbreak in one of our local skilled nursing facilities. Ideally, we would have fewer than 5 cases in a skilled nursing facility, and unfortunately, to date, we have 25 cases in a skilled nursing facility. I just want to give everyone a sense of warning. I had an excellent conversation with Dr. Mace this morning. I've also been in touch with our state representatives. The state of California remains very concerned regarding the increasing rate of transmission and spread throughout the state of California. A number of counties have already actually received orders from the state to shut down some of those businesses, right, and ratchet it back. And I just want you all to know that we are not currently in that category, but we well could be on our way to becoming in that category. So, it's very possible that within the next week, find ourselves on that list where we do have to start seeing businesses close down or alter their operations to indoor activity. So I just wanted to give that warning, which brings me to my next comment, which is that we are about to jump into the holiday weekend. It is the 4th of July weekend. We are expecting large crowds, people coming into Sonoma County to come and spend the holiday weekend. And unfortunately, without any warning, the state of California did issue an edict closing the parking lots at all of our state beaches. So, that means that there's going to be very limited access to state restroom facilities and state parking along our entire 55 miles of Sonoma County coastline, which is going to create traffic jams. It's going to create a lot of crowding in our regional parks access point, and also can create very dangerous situations where folks are parking on the side of the road or parking in people's driveways in residential neighborhoods. So, I personally am going to be spending the weekend home, and I just, from one person to another person, I really think that it's a great weekend to stay home and to just spend time with whoever is in your household. It's also not a good time to go and have a party, even with just a few friends. We are, throughout the state of California, seeing increasing rates of transmission just from birthday parties, casual gatherings. It's so hard right now to be in this moment, right? Because you want to be with your friends, you want to be with your family, and you want to be able to give them hugs. You want to act like it is normal. But now is not the time to let down your guard. We are seeing those cases increase. It is getting serious in the state of California. And so I would urge you just to be safe, stay home. If you're going to go out for an essential activity, please remember to wear your facial coverings, because this weekend really matters. With the number of cases that we currently have out in our community, if we have large numbers of folks gathering together, that could really make the spread very rapid here in Sonoma County. So please stay home, be safe. With that, I will turn it over to questions. Oh, one other thing that I wanted to mention. Next week, which is on Tuesday, the Board of Supervisors meeting, I believe that's July 7th. Yes, it is July 7th. We will be having an item in the afternoon regarding homelessness. And I had a meeting this morning to discuss the evolving plans around Lower Russian River. How are we going to stabilize the homeless population there and try to reduce transmission risk through creating a safe, socially distanced, some kind of a sanctioned encampment, or are there other facilities that we could rent or look at? I've been, trying to sort of rack my brain for any possibilities, trying to make sure that we have looked at every possible location where we could provide some safe facilities for homeless people to stay in that would minimize the transmission risk of COVID-19 and hopefully assist them into getting into actual permanent supportive housing, right? Get them off the street, get them into houses. And I want you to know that we'll be getting an update about that process at the Board of Supervisors meeting on Tuesday afternoon. So if you're in the Lower Russian River and you want to learn more about where we are and what we have learned, please feel free to, listen into that meeting and make your public comment, and we'll try to answer any questions that you might have. With that, I'm going to turn it over to questions, and I am going to scroll through. Question from Debbie. Is there a spot on the dashboard where we can see if we are on the state watch list? I understand closures come from the state after 3 days on that list, but I cannot find it. That's a great thing, actually. I will, a great suggestion. I will actually send that over to our PIO team because I think that would be very, very helpful. I don't know if it might be on the state website. I know the state website is covid19.ca.gov, I believe. But the state website, and I will try to see if I can get our PIOs, which are public information officers, to provide that information on the website. I think that would be very helpful for everyone to see. Deb says that she saw the barricades going up today on the coast. Just stupid. I agree with your assessment on that. Sil says, stay home. Fireworks and SF will be on TV. That's a great suggestion. And Vesta suggests to wash hands frequently, use hand sanitizer every time we touch common surfaces. Curie suggests our county needs to pass a sales tax to fund a village dedicated to the homeless and their needs. And, actually, I do want to mention that we are considering putting a 1/4-cent sales tax on the ballot in November. And this was underway long before the pandemic. We've actually been doing polling throughout the pandemic, sort of recognizing that, people are experiencing severe financial hardships right now. So it's a really hard time for government to go and ask people for more money. However, this is actually specifically targeted to mental health services and behavioral health services, and in particular, homeless population. And so we're finding that people are still actually, at least according to the polling that we've done, willing to consider that kind of a funding mechanism. So you may actually have an opportunity to vote for a sales tax to really try to wrap our arms around the mental health crisis that we are in Sonoma County, and just the overall lack of resources. Unfortunately, every year, costs continue to creep up as they do all around the country, and the federal government has really kept our ability to fund those critical mental health services flat. And so we're sort of faced with stagnant income from the federal government and then increasing costs. And then we're actually seeing increasing needs in Sonoma County as well, with the repeated trauma of fires, floods, fires, and now a pandemic. It's really a challenging time for a lot of folks, and we need to make sure that they, have the resources that they need. All right, I am looking. Let's see. Question: why is nothing done from Claire? Why is nothing done being done to educate people on the concerns regarding masks with breathing vents? Studies have shown concentrated streams of contagious air being forced outward should not be allowed into stores with a breathing vent mask. This is something that I will definitely reach out also to our public information officers to try to get some information out about that. I totally agree with you. Unfortunately, those vents are great, and for if you're going to be in the middle of a fire or a dust storm, they allow you to sort of protect the air that you're breathing in. But the whole point of the facial coverings, right, is not to protect you from the virus. It's actually to protect your neighbors. And so those vents do the opposite thing, right? They allow your out breath to just kind of funnel right out there into your neighbor's breathing space. And so Claire raises a really, really excellent point. And I will also add that to the list of things that our PIOs should be messaging outward about. We're also, just so you know, we've been in the midst of a big push to try to get out messaging regarding, be safe on the 4th of July, stay home if you can, wear facial coverings, don't forget to social distance, don't sort of be having parties between households. So we're trying to get that word out through press, through social media, through the radio, and all different sorts of things. I also want to let everyone know, I know there's a lot of fear, especially in Lower Russian River residential neighborhoods, about folks coming in, parking illegally, making it very difficult for emergency vehicles to get through. And I actually have photos on my phone right now that Johannes Hoverts from Transportation and Public Works sent me. They actually did go out and install some temporary no parking signs to ensure that doesn't happen. We did install permanent signs, and we moved forward with that, working with the neighborhoods. There are actually new, just foldable, collapsible signs out there right now. So hopefully that will help keep people away and keep things safe. Question from Sil: other restricted counties, people will come here. Who enforces masks, compliance, etc.? So ultimately, it is the sheriff's office in unincorporated areas who is responsible for enforcing the public health order. They are taking an educational approach. I was actually on a Zoom meeting with the sheriff at 4 p.m. today, and he said he's actually seen a substantial decline in the number of complaints pertaining to the public health order. So if you do see areas that you think are very, very dangerous, do please give a call to the non-emergency sheriff's phone number to let them know that they should go out there and do some education. Judy asks, will there be mask enforcement? Partly in response to concerns about equity and escalation, the sheriff is actually taking an educational approach. And right now, I think that the way that it works is that a violation of the public health order is actually a misdemeanor. And if you're going to fine someone for that, the fine is extremely substantial. It's $500 to $1,000. So it's extremely expensive. So they're trying to focus on education and outreach. And then we're also investigating other mechanisms, like if we could sort of use code enforcement as a strategy, which would have a much lower fine, but there also becomes concern when you have such a widespread, challenge in terms of enforcement, making sure that we are enforcing equitably. So I think that's why people are starting with education. I did just answer. It looks like Sarah had a question about, is the county considering a fine for not wearing masks in public? So that was originally, it's a misdemeanor, $500 to $1,000, but we could potentially look at a smaller fine, and that would be more of a slap on the wrist, but a good, strong reminder for folks to be able to go forward with that. Question from Christine: how are we prioritizing the reopening of schools in the fall? If bars, casinos, restaurants, etc. are open, we should have schools open. This has been something that I just feel like I am beating my head against the wall about. There was a editorial in the New York Times today, which is, why are we not talking about schools? Why are we prioritizing these much less essential services over the education of our children and the ability of working parents to safely return to work without having to worry about their children? There are also concerns about a hybrid model. So basically the options for schools are, number one, there's no in-person school, right? Everybody has their kids at home and everyone is just learning and doing distance learning. Number two, all of the kids are in school, right? And they are kept in pods and they're not allowed to maybe mix in between different classrooms. They're not allowed to mingle with other classrooms, but they're kind of kept in set groups of children that, learn together and eat lunch together and play together. Number three, the third option is a hybrid model, right? This would involve partial distance learning and then partial in-school learning. And so the benefit of this is that you wouldn't have to have more staffing, more teachers, right, to make this happen, because in order to meet the smaller classroom requirements, you would basically split your class into two, and half would come on Monday and Wednesday and half would come on Tuesday and Thursday. And the challenge with this is that it actually potentially creates more vectors for the virus. And so you could have, if you have, say you're a working parent and you don't have any ability to stay home with your kids, right? So then your kids are in school, say Monday, Wednesday, but on Tuesday they're in a different, sort of childcare setting. And then on Thursday, they're on another childcare setting. And then maybe they're even in a third childcare setting on Friday. And so that actually creates more potential transmission than having a same stable group of children at school. So, this is a very complicated sort of problem and no one has a good answer for it, to be honest. I mean, I've heard from friends in other states and it's just everybody is struggling with this and grappling with this right now. And the fact is that we don't know what things are going to look like in 1 month, let alone 2 months when school opens. And so it's very, very difficult to say at this point in time. I will say that, Sonoma County Office of Education, Superintendent Steve Harrington, Dr. Mace, as well as the state. I mean, everyone's working on guidelines and schools are kind of adapting, to do different surveys of parents. What do you want as a parent? I filled out a few for my kids. So, it's a challenge and it's an ongoing challenge. And I'm sorry, Christine, I don't have any answers for you, but just a lot of empathy. It's just so critical that we keep our teachers healthy, we keep our kids educated. And right now, all of these things are in tension with one another. Question from Rachel. Do you imagine non-essential retail stores being ordered to close in the next week or two? My gut says yes. And so it's a unfortunate thing, but I do think that we will find ourselves on the state watch list and we will see indoor retail close. I believe, and I'll have to double check this, but in the counties that were ordered closed already by the governor and by the state of California, they did allow curbside retail to continue. So I really believe that we need to keep investing in, online shopping opportunities for local marketplaces. I don't want to live in a world where we Amazon Prime everything and our retail stores are not able to get through this pandemic. So how can we support you? If you run a retail shop, how can we support some kind of a, go local Sonoma County specific online marketplace? I would love to work with folks on that. And we have sponsored some of those kinds of projects through different chambers of commerce already, but would love to do more. From Claire, there needs to be mask enforcement. The fact that it isn't being mandated is completely absurd. So it is being mandated, but it is not being directly enforced in a punitive way. So it is being approached through an educational process. And this is extremely frustrating, right? I think the worst thing about masks is that, when you're wearing a mask, right, and you see someone else not wearing a mask, it is so frustrating because you're wearing the mask for them and they're not wearing the mask for you. So it's like unrequited friendship or unrequited love. And I think that we all need to hold each other accountable. That doesn't mean shouting or yelling at people or being mean or being rude, but just the more that we can model the best behavior, people respectfully, they need to wear masks, that it's not about them, that it's about all of us. And quite frankly, people refusing to wear masks, especially indoors, especially inside establishments, is exactly what's going to send us into stricter and stricter lockdowns in the state of California. So the more that we can remind people, the more that we can get law enforcement to remind people, the better off we will be. Ooh, Vesta has an interesting comment. Use the candle test to see if your mask leaks. If you cannot blow the flame on the candle, the mask works. All right, let's see, question. Maya says, how about you open the beaches and let us celebrate our freedom by letting us be free? There's no scientific evidence, and for some reason I'm not able, there we go, to back your decisions. I want to be very clear, Maya. The county of Sonoma, our beaches are open. So it was the state of California that did make an arbitrary decision to close the parking lots at state beaches. So I actually agree with you. We actually do not have any scientific evidence to back, transmission at beaches. We do not have any evidence that we are seeing transmission in our regional parks, whether those are regional parks that are in the interior of Sonoma County or whether they are coastal parks. And so I don't, quite frankly, understand why the state made that decision. And I think that it will actually create less safe, not more safe circumstances in Sonoma County this holiday weekend. So I think it was unfortunate. I think he was trying to, maybe send a message that the Bay Area, you shouldn't be going to the beach. But the fact is, people are going to go to the beach anyway. And this way they're just going to be less safe. So I agree with you, Maya. And unfortunately, the decision was not mine. And I do want you to know that I immediately called our state representatives. There was nothing that they could do to reverse the decision. But I did try to get the state to reconsider, and I did not make any headway. Carrie says there's been many fireworks and M80 type explosions in Guerneville and Monterey. I would add we've been experiencing that in Forestville as well. It's extremely concerning. We've also been putting out messaging about that and working with our fire districts to try to educate folks. Unfortunately, my understanding is that Rohnert Park is still selling fireworks, and I really wish there was nowhere in Sonoma County that sold fireworks. I recognize that there are nonprofits who make money selling fireworks, but quite frankly, if our county burns down as a result of someone selling fireworks, that wasn't a great investment. That wasn't a great return on investment for that nonprofit. So I wish we didn't sell fireworks in Sonoma County. They are illegal in unincorporated Sonoma County. So if you are using fireworks, you are in violation of the law. And unfortunately, it's just very hard to catch people who are doing that in real time. A question from Bobby. How much influence does the county have in advocating for increasing and extending unemployment and closing businesses until this plague is under control while making them financially whole so that they can close? I think that in a perfect world, what we would do. And I do want you to know that I have been on the phone frequently with our federal representatives, our county, that works for Sonoma County to advocate for us in DC. They're asking for more money businesses, for more money for nonprofits, and for an extension of the increased enhanced unemployment benefits. I really do believe that the best way to get through this as a country is through strengthening our safety nets and just carrying those businesses that we know are particularly and completely unfairly hit very hard by this business, right? Hospitality has been hit extraordinarily hard. Our restaurants have been hit extremely hard. So too has retail. And so really looking at those businesses and trying to, prop them up, trying to give them more infusions of cash. And unfortunately, we have just completely, Stephen Gale, who works in Congressman Mike Thompson's office, I think he likes to use the word intransigent when he's describing the Senate. It's just they are really, really totally stuck in the mud and refusing to help the community when I think that we most need it, which is why we're seeing cases explode throughout the United States to the point where Europe says we don't even want Americans coming, right? We're not going to let you come because your country is a hot mess right now. So I really appreciate your feedback, Bobby, and please know that we are trying to run that up the flagpole at the federal government. And really all of your help can contribute to that as well. So pick up the phone, send an email, call your congressman. If you've got friends in other states, especially in red states, pick up the phone and call them and get them to call their congressman. That's what's really going to take. It's going to take sort of a broad coalition across the country, not just from liberal areas like Sonoma County and California, but really trying to get pressure from the grassroots all across the country. All right. Let's see. Scrolling down. Judy says people aren't calling the sheriff to complain because of his lack of support of the public health officer. Having a little hard time. It won't let me see the rest of your comments. So I apologize if you had a question because I can't click on it right now. And Emmett is still downstairs on putting Lyndon to bed duty. So Frank asks, have you bought the idea that supervisors in all districts look into creating navigation centers in their specific districts? Yes. So Frank, I would really encourage you to look at the Board of Supervisors meeting that is happening next Tuesday. I believe it's item 34. It's on the afternoon calendar. So you can call in. You can either call in via phone or via Zoom. You'll have an opportunity to make public comment, and I will be advocating for a geographically distributed navigation centers in every single supervisorial district. And I do want you to know, Frank, that we have continued to look at all possible solutions, even just interim solutions for the Lower Russian River for the next 5 months. So looking beyond, the river park and the park and ride, we've made inquiries at various campgrounds and other things. So we'll have an update for everyone on Tuesday to see if we hear anything more. All right. Let's see. Question from Barbara. Do they know why senior places are getting the virus more often? So, this is just a situation where these skilled nursing facilities were not designed to eliminate transmission of an airborne virus from the folks that live there, right? They were designed at, they're congregate living facilities. So you have a lot of people living in an enclosed space. Sometimes you have multiple beds in one room, which allows for things to, transmit very easily through air. I don't want to draw a direct parallel between skilled nursing facilities and jails, but I do want to acknowledge that there are similarities in terms of the number of people living in a confined environment and breathing the same air. And what is happening right now in San Quentin is actually not too dissimilar in terms of what we can see, outbreaks happening in skilled nursing facilities, because you have, areas that don't always have, hard between every single person. San Quentin, actually, I learned from Senator McGuire, they don't actually have the, sort of standard solid doors there. It's a very old style prison, and it's sort of like what you would see in the movies, bars rather than actual solid doors. And so you have an ability for the, breath and the virus to be transmitted through the air very easily in San Quentin prison. And actually, and again, I don't want these, these are not the same things, but there are these similarities where you have lots of people living under one roof and in areas where they're not socially distanced and where there is common air. And so that's unfortunately why we are seeing these outbreaks in skilled nursing facilities, is just a lack of ability to isolate people into the kind of, containment systems, either through physical containment, right, of, solid doors and completely separate rooms, or where you have negative pressure type containment. And so it spreads very quickly. And unfortunately, that has led to a number of fatalities within skilled nursing facilities in Sonoma County this week, because these are some of our most vulnerable members of our community. So it's really, really tragic and very, very concerning. And that's why that's one of those criteria that we are constantly monitoring. And right now we have 25 cases in skilled nursing facilities, and ideally we would have less than 5. And then, you have folks who are working in those skilled nursing facilities, and if they unknowingly catch COVID-19 and they're asymptomatic, they can then spread it to their patients. So it's very concerning. We have seen positives both in the patients of the skilled nursing facilities as well as the workers who are doing that. All right. Let's see. Cindy suggests, I'm a pet groomer. We do not let anyone inside the salon, all curbside with facial coverings. That's fantastic. And I think that's what we need to be really thinking about, is how can we minimize those indoor interactions? Because everything is suggesting that it's really those indoor interactions between people, especially with prolonged periods of time, that have the highest risk for disease spread. So Cindy, that's a fantastic model. And that's a really good one that I think that more people could emulate. Robin says, why is the Press Democrat not posting by areas of the county that are reporting COVID-19 positive cases? They may just not want to post all of the data, but if you go to socoemergency.org, we do have kind of the data by geographic region. And it's not town specific, right? It's West County, East County, North County, South County, and Central County. But the Press Democrat has been excellent in terms of, they do cover things in real time. I'm constantly getting texts from all the different reporters, and I know that they are obsessively and in a good way trying to get the word out to everyone. All right. Other questions? Let's see. Leo had a good comment that he talked to the fire marshal, and if there are illegal fireworks going off that are dangerous, it is law enforcement that can enforce. So unincorporated Sonoma County, call 565-2121 for the sheriff non-emergency line, which is the same line that you could use to report health order violations. So again, if you hear illegal fireworks and you're concerned about that, 565-2121. However, if you have a fire, if you see a fire that has started, that is a 911 call, and that will route you through dispatch to your local fire department. And just a reminder that if you are inside the city of Santa Rosa, you would want to call the Santa Rosa Police Department. And we do not have that number memorized because, we mostly talk about unincorporated communities out in West County. Question from Richard. Whatever happened to your valiant effort to have reasonable consequences for those few vacation rentals that refused week after week to comply with the shelter-in-place public health order? They appear to be let off the hook entirely and resuming normal operations, which punishes those who complied and is unfair to the residents nearby who had large outside groups in the community week after week, often from out of state. This is one of those frustrating speed of government issues. We were actually just about to move forward with looking at taking, empowering code enforcement to go after those folks, when then, the state suddenly decided to reopen hospitality. And so it became no longer relevant, and you can't people in hindsight. I do want you to know that we are going to be tackling vacation rentals as sort of a big picture conversation. And obviously, you know that it's something that's local coastal planning process as well. But what we're doing with, with respect to the county will not apply to the coast yet until we get that local coastal plan updated. But outside of the coastal zone in the rest of Sonoma County, we are looking at creating a cap on vacation rentals. And that cap will essentially allow us to sort of keep static the number of vacation rentals that we have in our community while we look at policies to address the impacts of vacation rentals. I've just been receiving a lot of feedback from communities that live, in high tourist destination areas, particularly in the lower Russian River, as well as the coast, that there are more and more vacation rentals than ever before. And then especially in the lower Russian River, the entire neighborhoods that used to be primarily residential are now becoming primarily vacation rentals. And I think that fundamentally we need to maintain the integrity of the primarily residential nature of rural residential zoning, right? All of our zoning that we've got in Sonoma County talks about residential, not commercial. It's not meant to be an entirely tourist destination location. And we do run the risk of it turning into something like Marshall. If you look from a few years ago, Albert Strauss wrote this great op-ed, I think it was in the Point Reyes Light, about Marshall, California, where he grew up, and just watching it be completely hollowed out until it was only, vacation rentals and second homeowners, and there was really no one left. No kids in the schools, right? Dangerous over the winter when nobody was there, and, then people would have houses broken into because no one was watching the streets. So anyway, just want you to know that we are going to be addressing vacation rentals in a nuanced, thoughtful way. There are some other counties that actually have percent caps on the number of vacation rentals, so you can have some, but not too many. And I'm looking forward to having that conversation with the community. All right. With that, I am probably going to wrap it up. I don't see, or actually, let's see if someone says, yes, I would like an answer to this. Oh, but I'm not seeing what the original question was. I'm sorry if I miss any questions, because I'm seeing a lot of comments. And I'm trying to sort of go through and track the questions. I don't see any last questions. Still trying to scroll through. A question from Lorinda: why are you not speaking about the number of negative test results? Negative test results would just be the total test results minus the positive. So I can't do the math, but you've got, right on the top of my head, but you've got 49,615 tests and 1,229 cumulative cases. So that would be, you take the one and you subtract the other, and that would give you the number of negative test results. Question from Robert: I take cover this weekend from the out of town, and it sort of trailed off there. I personally am going to be staying home this weekend because I think that it's going to be completely swamped in West County. All right, I'm not seeing any other last questions. Or I guess Angela asked, the shelter in place? And I'm not totally sure. Oh, Rebecca said, yes, that was about the rentals. So sorry. I'm trying to keep up with everything. I don't have my husband sort of reading the questions for me. But anyway, thank you all for joining me tonight. If you have any questions, email me. You can email me at either linda.hopkins@sonoma-county.org or district5, that's the number 5, at sonoma-county.org. Have a safe weekend. Stay safe, and I will keep checking in with you all every Thursday night. So take care.